Welcome to Beyond Limits. I'm your host, Dr. Sharanya. From leading experts to everyday takeaways, this is where health meets possibility, where we give you science backed insights and actionable tools to help you live healthier, longer, and stronger beyond limits. Welcome back to Beyond Limits. I'm your host, Dr. Sharanya, and today's host is someone whose career spans decades, yet his vision is focused on the future. Dr. Alexander Thomas is not only a renowned orthopedic surgeon and a hospital administrator, he's also a reformer, a builder of institutions, a national voice in healthcare and policy. He was the CEO of the Bangalore Baptist Hospital and is also one of the founders of platforms like CAHO, AHPI, and Anbai, and also Vahya Vahini to shape the very backbone of Indian healthcare. But here's what makes the conversation more exciting. Today, he's leading the new wave of longevity, and he's also the chair of the Rise Longevity India Conference and a strong voice in the lifestyle research. Dr. Thomas is now working in the intersection of science and systems and longevity, helping us ask how can we not only live longer but also live a longer and healthy lifestyles. In this episode, we unpack lessons of a lifetime leadership, explore the science behind healthy aging, and talk about what it really takes to build a healthier future for individuals and for nations. So whether you're a doctor, a healthcare practitioner, an entrepreneur, a public health nerd, or someone who just cares about living well, this is a conversation you do not want to miss. Today, we go beyond clinical care and talk about shaping systems that care for millions. And we have our guest, Dr. Alexander Thomas, with us. So, very warm welcome to
Thank
you
you.
to
Pleasure
this
to be
show. And we're going to have a lot of insights about healthcare on this podcast. So, if I may ask you, you began your career as an orthopedic surgeon, as a young graduate in CMC Vellore, and then you moved on to become the CEO of a major hospital in Bangalore called the Baptist Hospital. You transitioned from a young orthopedic graduate to a leadership role. What actually made you take up that change? Because back then it was not very common.
Yeah, actually, I'll go a little earlier. I started my career as an intern in the Bangalore Baptist Hospital,
Okay.
and then I was sent by the hospital to do my orthopedics in Vellore. Came back, started the department, then became CEO, and then got into other activities. Now, my experience on the ground, I worked 35 years in Baptist Hospital, and knew that a lot of things were not very standardized, were not coordinated. And it's very surprising that the concept of quality in healthcare just came in maybe a decade or more, a little more than a decade. So I've always been saying, how can we influence the healthcare delivery, medical reforms? And we had an opportunity soon enough. We were running the DNB courses in the Baptist Hospital, and suddenly they decided that the selection which we were doing individually by different hospitals, the government, the DNB board took it off us and said they will do it. So we felt that that was not right, because in Baptist, what we were doing, where we were getting graduates who are willing to serve the community and preferring them to join, and we give them marks. It was a very transparent process. So we actually joined forces to form an organization called UNBY, the Association of National Board Accredited Institutions.
Right.
We went to court, we lost, we were fined, but that's another story. But that, and there's another incident. We were actually doing this CGHS, Central Government Health Scheme.
Correct.
The government owed us a lot of money, and they were not paying. So we tried to fix an appointment in Delhi. And when we went as CEOs, we were met by the clerk to the undersecretary who made us wait for a long time.
Right.
So then we said we must get together. That's how Anbai started.
Okay.
And then with Anbai, we got experience from that, and that we took to other areas, because policy is very important, and we felt that going together as a collective voice makes a difference.
But you founded major institution that define today's healthcare sector in India. If I were to say, we went from a pretty unorganized setup 20 years ago to a very much organized setup today. Like if I would say NABH was something that you have enabled today. NABH is something that every hospital, it is like a dreaded story that the minute they say they have NABH accreditations or NABH, they're going to apply for it. We see that the entire system in the hospital falls into place. So, what were your key when you kind of went ahead and said that this is something that I want to set up for healthcare in India?
So after a success, it was actually very difficult to get people together, and hospitals are very fragmented. It's very difficult to get them on the same platform. But we've had some success. I'd say that we're about 70%
Right.
united now. So Anbai was the same story. I think beginning there were 3 hospitals, and now we have actually uh, gone all over the country. So at one of the Anbai meetings, Anbai is very restricted to only postgraduate training institutions.
Right.
So he said that there should be an institution which represents hospitals all over the country. And that was how AHPI started, the
Right.
Association of Healthcare Providers. We have about 20,000 hospitals in the country today, and we do impact policy, we do impact healthcare delivery. Subsequent to that, we thought it would be good also to have an organization which focuses on quality. And that's how the consortium of accredited healthcare organizations came about. And all 3 are doing very well, surpassed the whatever I had in mind for them, doing very well and they have impacted the quality of healthcare delivery and medical education.
Can you give us some anecdotes about how your journey was when you were trying to set up these systems across various verticals? Because it is just not a one person journey. Here you require various stakeholders, especially at the CEO level. Then you have stakeholders at the doctor's level. Then you have stakeholders at various levels in the hospital. Can you give us some anecdotal incidents about how your experience was through this and what were the takeaways from each?
See, Anbai, the when we started, I told you we had only 3 hospitals. It was very, very lukewarm, and the National Board of Exams didn't actually even look at us. I was blacklisted for 3 years for starting Anbai. But then, as it became more difficult to communicate with the National Board of Exams, hospitals slowly started coming together.
Right.
And today we have an example of the National Board and the Anbai. We work very closely together, and they listen to our suggestions. They address our members twice a year. So learning from that, it was relatively easier to start with AHPI and CAHO. And I remember, even though we had some 2 years experience, when we had our first CAHO conclave, I think it was in Delhi, 6 weeks before the conclave, we didn't have any money, but somehow it worked out. Yeah, there were a lot of difficulties, but basically it is, I think, the team. I mean, I was only one of among the team, and we were able to get together. But people who are on the same page,
Right.
And no egos, no hidden agenda, transparency, and passion for the cause.
Right. So, in your experience, what does true leadership in healthcare look like?
If you're looking at actual leadership in healthcare, I think the end of the day, you have to keep repeating transparent. You have to have no hidden agenda. You have to be committed to the cause, and that by itself is not enough. At the end of the day, you have to transform all this into measurable outcomes. I think that's
Right.
very important.
I think that's very important for youngsters who are looking at pursuing hospital administration because now that's a structured PG course in India today. So, how do you see that landscape changing, sir, from when you took on Baptist to now?
I'll give you a very simple example. Even my perception have changed. When I was doing my PG in Vellore, I had something called hand surgery posting. That was for 6 weeks. And you may not believe it, I was the only resident, hardly slept for 1.5, 2 hours a day. I lost about 8 kilos. I went from Bangalore there. But today I look at it differently. I mean, those days we thought it was very heroic not to sleep and work. But it is a risk to patients, because at the end of those 6 weeks, I didn't know what was happening.
Right.
And now I'll talk about it later. Now I'm now into lifestyle medicine, where sleep is a very important factor.
Right.
So now I'm actually now lobbying that you also done
Yes.
your internship, that interns and residents should not work more than 8 to 10 hours a day. They should be ensured that they get at least 6 hours sleep a day. A total change. It will mean a huge increase in the expenses, because you probably have to hire twice the number of
Right,
residents.
doctors and residents. Right. So that's really beautiful to
Mm.
understand, because as interns or residents, we most often see 34-hour shifts, 48-hour
Yeah,
shifts,
shifts.
which is a common practice in India. Although Western, they have made it, a strict this thing that not more than 12 hours of work and then you get a day off work. But it's really interesting to see what change you are looking at bringing about. So
No,
now,
even in the West, I don't think they've been successful.
yeah,
I think it more often than not that you continue these
yes,
shifts, and the students don't object too much, because ultimately their environment, the passing of exams, etc., is dependent on their bosses.
yes. So, and one more thing I really feel very amusing about you is that you've moved from a doctor to a medical leadership professional, and now you're guiding the entire healthcare fraternity in a policy maker and a policy change kind of a way. How has that transition happened to you over the years?
See, the when I retired, I mean, I had a lot of good experiences in Baptist, having started these organizations. We have a huge mission network in the country.
Right.
So my first aspiration after I retired, it was more than a decade ago, was to try and strengthen the mission network. We have a lot of mission hospitals; all of them are not doing well.
Right.
Unfortunately, I created standards for them, but they were not very
Hmm.
not open to the idea, because there's a little bit of corruption, a lot of nepotism.
Yeah.
So then I think it was just God guided me into the national stream, because I had created these hospitals are probably 1% of the total hospitals, but that experience, during the time I worked with NABH, with National Board, and I realized that it would be more impactful to work at the national level.
Right.
And I'll give you an example. When I was at Baptist, we started something called
Hmm.
the communication movement.
Hmm.
The first communication book in the country was written by us when I was in Baptist.
Right.
Looking back, it seems rather strange that we didn't have communication in our curriculum. So I actually started this movement because when I took over as director, I knew all the problems. We did a
Hmm.
root cause analysis and found that communication was the major problem in everything we did. 70 to
Right.
80% of errors were because of communication, staff interaction. So I actually invited the Mudra School of Communication in Delhi. It's not in Delhi, Ahmedabad.
Right.
It's the foremost school in communication, and fortunately for me, the new dean had just come from the US, and he was an expert in health communication.
Okay.
Invited him over, we came up with a SOP. It worked so well for us that I said we can't keep it to ourselves. Long story short, we wrote this book. It was a hit. It's now in its fourth edition. We were able to actually lobby with the Medical Council of India, got into the curriculum.
Hmm.
So that's an example. See, earlier to that, we were doing communication workshops, traveling here, there, training trainers. Today, as we speak, about 2.5 to 3 lakh students are being taught this on a daily basis.
Right.
And it was a result of policy change.
Right. So as a result, I think at the end of the day, the patient is the one who's getting the
Absolutely.
most benefit out of it.
Absolutely, yes.
Because I think a clear set of communication and guidelines, for example, it is not different from each and every hospital. Now, every nurse practitioner, every person in the lab has like a set rule of communication. And I think the patient at the end of the day gets the best of care.
Yes, and it's been proved that good communication outcomes are much better. And there was a statistic. This was in Australia and UK, where I worked for a short while. There you see only about 10 patients, not
Correct.
like here you see 60 patients. There, within 18 seconds of the patient starting, you interrupt. Here it's probably in about 2 seconds. So the important lessons are you listen. It's very, very important. Listen, and two is listen with empathy and communicate and compassion. If you listen more, the process of healing starts.
Yeah, I
there
think
itself.
one becomes more involved in what the patient is actually feeling,
Yes.
rather than becoming a simple prescriber of medication.
And listening also has a therapeutic effect.
Right.
To the patient. When
Yeah.
you listen to him, you start developing trust, and outcomes will differ.
So next, moving on to that, you have led, great efforts into, accrediting hospitals in and around India. In fact, across India, you have led this campaign. And Why do you think that this sort of healthcare accreditation is important for a country like India?
If you look at pre-NABH, and when I'm talking about NABH, I'm talking about accreditation, there was absolutely no system to tell you whether a hospital you're going to is safe. So accreditation actually brings in a lot of standards, a lot of SOPs, and which are checked, and outcomes. And the focus of accreditation is patient safety and patient satisfaction.
Right.
So this was not there till maybe 15 years ago, and so it was very dangerous. So uh, after introducing that in India, we have seen the difference. But then, having introduced it in India, we realized that it was only the big hospitals which could afford, because some of them require a lot of changes. And that's where, again, I think I had the privilege of introducing something a little different. If you remember a little earlier, I told you that we tried to help mission hospitals and they were not.
Correct, yeah.
So I had actually created a basic standard, patient safety standard for them.
Right.
They refused it. Fortunately, my colleague Dr. Gyani was in QCI. They took it up at a national level, and today those are called entry level certifications.
Right.
It is not as high end as the gold standard, but it gives the patient some sort of a guarantee that patient safety is there, patient
Right.
satisfaction is there, and many thousands of hospitals have actually.
Right. So actually, if you were to kind of tell me that, what was my experience with accreditation, I think the first year when I joined college to my final year, we saw a great change in how patient care and information was changed only because of NABH, or even in the peripheries, because earlier in the first year when we were entering medical school, there weren't like rules and regulations of hand washing techniques, or needle stick injury techniques, what to do, what not to do, or even so the most dangerous thing, how to dispose of hospital waste. So I think like we saw such a great change, because now we did not need like a certain person monitoring it, because now it was all as per standards. They were supposed to comply. And so I think a lot of change was brought in as to how one saw just healthcare as not just doing the job, but treating the patients well, and doing the back end also.
But I think, having said that, there is a long way to go, because now what happens in now it's come down. Earlier, it was 70-80% of the hospitals. When accreditation came, there'd be a flurry of activity records. But what we say is accreditation quality is not something you just get. It's a continuous journey.
Yeah.
So we are trying to change the mindset of the people so that it becomes part of life.
Correct.
And ultimately, it definitely benefits the patients.
Right. So, what are some of the biggest misconceptions that people have about hospitals in India?
All I can say is that I think we are no less than the best in the world.
Right.
We have the best facilities in our country, comparable to the best in the world at a fraction of the cost.
Right.
Unfortunately, the public perception is very unfortunate that hospitals are fleecing patients, which is not true. I think that also has to change.
Yeah.
But I want to reiterate that India has, in all areas, be it in bone marrow transplant, be it in kidney, be it in heart attacks, we have the best possible modalities available, the best professionals, and our citizens, especially through the government schemes, all our citizens, very importantly, have access to that care.
Yes, I think that's a very, very important statement, because I feel like although the West claims that they have a really good healthcare, but I feel access is limited.
Yeah, I must tell you a story about this. Some years ago, Devi Shetty, he's a good friend of mine. We were going to Belgaum. There was some agitation or some problem. We were going, so we went by road. So we stopped at a very small, I think, Udupi cafe.
Yeah.
Small one, and we were having breakfast, I think it was. So there was a lady there who was serving us. Then after she finished, she came and touched Devi's feet and said, "You operated on my son many years ago." And she's a very poor lady.
Right.
She was able to access the best of care through the government schemes.
Right.
So, I mean, I was very impressed with that.
Right.
That, I mean, you may have the best care, but it should not be available only for those who have the money.
Right. So, and I think, can you also shed some light on, India becoming the center for hospital tourism or medical tourism, and how that landscape is slowly and rapidly changing with the availability of healthcare here.
Yeah, so I think this actually is a continuation of what I said earlier, that we have the best facilities, the best healthcare professionals. So more and more countries outside are now realizing that they can come here, do the surgery or whatever treatment, have a holiday, and go back.
Right.
And so that's a huge market. And the only bad thing about it is, unfortunately, this market at the moment, there's something called a middleman, and they actually charge up to 30 to 40% of the fees,
Right.
and sometimes they bring a bad reputation to our hospitals. So we've been meeting about this, and we have said that the people who come here should go back as the people from other countries who come here should go back as our ambassadors.
Right.
That'll happen only if we get rid of the middleman and make sure that the patients get the
Correct.
best possible access and the treatment here.
So you have been deeply involved in, various associations with regards to care, with regards to quality, with regards to system and policy changes. So I'd like to know, how far have we reached and what still remains to be done in a country like India?
There's a lot to be done, I think, but I think the journey has started. Uh, for example, with the government of Karnataka, we were able to actually introduce a lot of what we wanted. I was the secretary of the task force for public policy, and that is what is
Right.
being actually practiced now. I'm also the chair of the STG 3 committee, government of Karnataka. So we've been able to influence government of Karnataka. We've been actually able to make sure that all the district hospitals and taluk hospitals in Karnataka become postgraduate
Yeah.
institutions. And in fact, the Indian Institute of Management Bangalore is bringing out a case study on public-private partnership. That's something that we need to strengthen, the public-private partnership.
Right.
Now, what needs to be done? I think now I've realized that curative medicine is one thing, but I think we all need to focus on preventive medicine and wellness, because the power of your health is within you.
Right.
So I think that is something that we are now
I think
focusing on.
that is something that you rightly said, because I think once you have a disease, you can only manage the disease
Yes.
with today's care and with today's advancement in science. But I think preventive medicine, although really looked down upon, for example, if you talk about community medicine, right, most people would say that, this is not a spear that I would like to pick up. But now I think preventive and community medicine is kind of picking up the pace, because now people have realized what is the importance of prevention and lifestyle modifications. Now, that being said, if a young hospital administrator is listening to you today, what are some of the things or advice that you would like to give them if they want to create a long lasting impact?
Yeah, I think that is an they should always, young people who are in positions of leadership should also always realize that they have a role to play. And first is, I think, the self development. So develop yourself, make sure that you take care of your health, what you practice. Make sure that you get all your team with you. It's very important. Sometimes in our country, that is a little lacking. So
Yeah.
get everybody together. Make sure that there is no hidden agenda. Make sure that you're committed to what you do. And in a hospital, I think, and this is what I followed in Baptist, please ensure that the patient is central to what you do.
Right.
So you do all the changes and make sure that the patient is the most comfortable.
Now that you've given us such a good food for thought, when hospital leaderships are taking into place, especially in a country where we're going drastic change in terms of leaderships, because if I'm right, until last 5 years ago, hospital leaderships like the board of directors, except for mission funded hospitals, were all through legacy. There was no proper induction that was done, no proper training was there. Usually it would be an MBA graduate without a medical background. Now with medical graduates taking up hospital administration, what change can we see in this entire landscape?
See, at one point we had started going the way of UK, where they had non-medical administrators. But I think now, except in rare exceptions, people have realized the decision makers in each hospital, that having a doctor makes a difference. There are two, three reasons for this, and I'm sure you realize this. Doctors have a big ego.
Yeah.
and they don't like to report to a non-medical person.
Yeah.
And the other positive thing is that a doctor who's practiced knows what is
Correct.
happening on the ground. It's not that you're distracted and disengaged from what is happening. So those two areas, and now nurses have started taking up positions of CEOs, which
Yeah.
is good.
Yeah. I think, like you said, there's also, like you brought up the ego part. I think more than the ego, I think a doctor really understands what his patients want and need. So I think that is a huge part of care. And with nurses coming in, I think a lot is to do with because they also are at the grassroots level where they're treating patients at an everyday basis. I think that brings about a lot more change in the whole ecosystem.
I must tell you a little bit about nurses. Wherever I've gone, we have helped many hospitals, including NIMHANS.
Yeah.
The nurses have always been real pillars.
Yeah.
Very organized, very methodical, very disciplined, very mature.
Yeah.
In fact, in Baptist, I introduced a scheme of resident administrator, where they used to administer the hospital, and they did a far better job than many of us.
I think the power a nurse holds, whether in her OT or in her ward, is supreme. I think nobody can surpass that, even if.
In India, it may not be the case.
Yeah.
It's coming, but in India, unfortunately, nurses always seem to uh, be subdued by the doctors.
Yeah, but I think far so I remember during my training program, the nurses had the joystick to the
Good,
OT
good.
at
It's
least.
good.
Yes.
They should, because they contribute so much value.
So what were, you also are into a lot of sustainable growth development SDGs that you had already told us, and you chair the government in the SDGs for Karnataka government as well. So what are the biggest wins and what are the biggest gaps that you see in this entire thing?
Yeah, I also chair a committee for the Public Health Foundation of India, which works in health and climate change. So I think the biggest challenge is that we healthcare professionals know very little about the connection between health, the health sector, and climate change. For example, the health sector is one of the largest polluters of the environment.
Right.
We actually contribute 5% of the pollution. We are also thought leaders.
Right.
There are various areas, use of plastics, biomedical waste, etc. So in health, the first thing we are doing is we are trying to sensitize the medical community. We've just set up an all India network of about, I think, 12 chapters, getting champions, trying to sensitize them, and they're trying to sensitize others in the community.
So, sorry, I should have asked this question before I went on to the goals and gaps. Can you just tell us actually what do you mean by, sustainable development goals for healthcare? Where is that you're working into kind of, because I feel it's a quite a new term in healthcare itself.
So basically, in a nutshell, you're looking after the planet and keeping the planet a healthy place for future generations. In a nutshell, if you say that.
Right.
So it's a vast area.
Yeah.
And I've limited myself to just the health sector and climate change.
Yeah, I rightly said, the way when we would be in practice or generally, we see that everything comes packaged in a plastic.
Yes.
Like especially because you have to sanitize them and you have to maintain protocol. So I think it's a great initiative in kind of reducing waste at the source level in the hospital.
It's only faced now. You look at energy.
Right.
Hospitals use so much energy, so many air conditioners and others. You look at biomedical waste, you probably do the largest.
Yes.
You look at the use of water, huge
Largest.
amount of water. So it's various areas that we're looking at.
Right. So to move ahead with it, how do you see India balancing quality of healthcare versus, the affordability in the next 10 years?
See, there is a misconception that quality increases the cost.
Right.
Actually, it doesn't. We did a project with the World Bank of India and showed that even in Baptist, we had to spend a little extra money to get our act together. But after that, the patient footfalls increased considerably, and I think within a year or two, we were doing very well. So it actually brings down the cost. The risk of complication, the risk of readmissions all come down. So it brings down the cost of care. And I think I must compliment the government. They have actually, with these schemes, they have made quality care affordable for everyone.
So, and because you just mentioned about quality care, something that I saw in Baptist, I think it was implemented for the first time all across Karnataka, was that you had made like an entire system, suction system for collection of blood samples. Earlier what would happen is there would be one ward boy
Yes.
who'd run around through the hospital just to deliver these samples. But I think you guys were the first ones, pioneers in kind of bringing that technology into an already existing hospital. So I think that being said, yes, it made a lot of change because I think manpower utilization and various other things like just getting the blood test on time became more affordable. So I think that's
Yeah, that is an example of how you use technology to improve care.
right.
Actually, we learned it from CMC. It was during my time.
Yeah.
And yes, there was a lot of delays. We were a small hospital at the time. We had 10, 15 attenders just going all over the place, literally all over the place.
Yeah.
And this, it wasn't initially, it did cost money, but it more than paid for itself.
Yeah, but because I think I see the best of hospitals even today. They have this entire running around conundrum.
Yes, yes.
So I
No, I
think
think it's changing.
it's changing slowly, but I think you guys were the first to implement in Karnataka at least.
Yes, and it worked very well.
Yeah. So
See,
now moving on to your entire process. Now you've moved on from healthcare leadership to policy, and now you're also added another feather to your cap, that is your entire research on longevity, on working on health span and lifespan. How has that change actually come about, and what is it that you're doing in that space?
So actually, what I do is every couple of years, we try and focus on some subject where the healthcare professionals are not adequately informed.
Hmm.
We did that with healthcare and climate change. We did that with senior care. We did it with technology. Because as a doctor, basically a doctor community, we are so focused on what we do.
Correct.
And it's not good. So I was looking for a subject. I think the last one was senior care, and trying to analyze and research which one to do next. And then the answer was in lifestyle medicine. Fortunately, we have a very good partner in the Department of Lifestyle Medicine at CMC Velo. So we got together and we wrote a book on lifestyle medicine. We had a national health conclave on lifestyle medicine, and we have actually sent recommendations to the government. I think that is the key. If even 10% of our population start practicing lifestyle medicine, the curative burden will go down hugely. We will have a much healthier population, a more productive population.
Right. So now that you said the huge impacts of it, can you actually break down lifestyle medicine for us? That, what do you mean by practicing lifestyle medicine? Because there are a lot more components to it, I believe, and I am also a huge believer of lifestyle medicine itself because I think it's something we're not taught in medical school because we are taught to look at the differential diagnosis, then we see what the patient comes with, and then we say them, okay, this is what you're suffering from, this is what you do. But we're rarely talking about nutrition, we're rarely talking about exercise, or we're rarely talking about mental health. So can you please tell us what is lifestyle medicine and what does it encompass?
Yeah, so I think the important thing about lifestyle medicine is that you can control it.
Right.
You don't have a third person. So in essence, it actually lifestyle medicine is on a few pillars. The one, as you correctly said, is nutrition. Eat healthy. We've actually brought out a book on different recipes. Eat healthy. The second one is sleep. Sleep 6 to 8 hours. And I think I read an article also somebody recently, and there was a reason that so much misinformation was going around. So I read two articles. One was that somebody slept 2 hours every day and he lived to 100, which is not true. Second was a lady in the US who said she lived on a diet of oranges and she's doing well. So that was one of the reasons we bought out this book. So coming back, as I said, nutrition is very important. Sleep is very important. Mental health is very important. Exercise, I mean, people are now realizing the importance of exercise, resisted exercise. Then on top of the list, if you can have to choose which is the most important, it is social networking.
Right.
So that is very important, and I think people should be made aware of that. And of course, addictions. And when we talk about addiction, we're not talking only about medical. We're talking about addiction to the phone, to those gadgets. So in a nutshell, I think when you talk about mental health, it has been proved that if you show gratitude every day and if you forgive all your enemies, your mental health becomes much, much better.
Right. I think this is a great insight I'll take from you for today. So, and next thing is regarding, I just want to dig a little more deeper on each of these aspects, because I think like when you say sleep, there's been so much misinformation when we say 6 hours to 8 hours of sleep, right? 8 hours ideal, but at least if somebody can get 6 hours. Now, there are a lot of um, children or, teenagers, even adults who say that I get 8 hours of sleep. Now, the whole conundrum is it okay to sleep 8 hours from 2 a.m. to 12 p.m., or is there like a proper guideline as to when you should fall asleep and when you should wake up?
Yeah, there is a cycle. I don't get the name, but there is
The circadian rhythm.
yes, the circadian rhythm. So when the sun goes down, have your last meal and go to sleep. When the sun, follow the sun.
Right.
It's very
So
very
it is
simple.
very simple to say that you cannot sleep at 2 a.m. and then wake up at 11.
Yeah, but there are exceptions.
Yeah.
Some occupations have shifts. Some
Right.
people work. They have to adapt.
Right.
But generally speaking, follow the setting of the sun and the rising of the sun.
Right. Now you've been a great part of with ISC also you've been working, and I think one of your colleagues recently has been on the Nikhil Kamath podcast, and now that longevity discussion has got a greater audience. So with all of that being said, what are some of the myths now when it comes to nutrition or exercise? The commonest thing I see is most doctors, I've also been a false perpetrator of that. Exercise in the sense you tell your patients just walk, and this has been told by cardiologists like that. There are so many myths, and what are some of the major things that you could think of and tell us, that these things are the major perpetrators?
I think the major myth in India today is as you grow older, you become useless. So I think with that in mind is what we started Vaya Vikas.
Yeah.
That also deals with aging, healthy aging.
Yeah.
So this is one of the major myths in India. When we have realized that after 60, actually a person in India has a lot to offer.
Right.
So actually from Vaya Vikas, you've tried to see whether a senior citizen who retires can be engaged with what he was doing.
Correct.
They have so much of
Correct.
so much of experience. That is one. And yeah, there are a lot of myths like nutrition. Basically, what is felt now is that plant-based diet is the best.
Right.
I'm not saying you should have only a plant-based diet. Plant-based diet is best. Have a good breakfast, good lunch, and a light dinner. Have your dinner 2 hours before you sleep.
Right.
So that's about exercise, a very important point. Walking, studies have shown that walking is good, but it's not enough. So especially in people who are after 40, 50, resisted exercises are very, very crucial. Right. So that is something that we have to.
So since you're like an orthopedician as well, so could you kindly shed some light on osteoporosis? It is a growing problem, and especially we are seeing that more than men, women are falling prey to it. And I see every day I run across in the apartment and I see a lot of ladies in their 50 plus, they are limping, but they still choose to walk over resisted training. So why do we have this sudden burden of osteoporosis in India?
It's not sudden. I think it's always been there. It's only
Right.
being recognized now. Now, one of the reasons that people are a little resistant for resistant exercises is that they are advised go to the gym, use dumbbells. So we use a very simple thing. Use your body, use squats, do push-ups. Start off with that.
Right.
And that helps to some extent. But see, for a person to do something, it should also be easily accessible.
Right.
And in Indian context, all of us can't go to a gym, all of us can't buy dumbbells, etc. So we try and keep it simple.
So right now in an Indian context, especially where we're seeing the rise of chronic diseases like hypertension, diabetes, we're already the capital for diabetes, and we may soon be the capital for hypertension as well. How do you see lifestyle medicine, playing a role in combating these chronic diseases, and also in terms of preventive, you've already talked about, so in combating and managing these diseases?
Yeah, so again, our collaboration at CMC, they're doing a lot of groundbreaking research on this. So they have actually said that if you follow the 4 pillars, their diet, exercise, nutrition, sleep, etc., they have actually evidenced that diabetics go into remission. Cure may be difficult, but they go into remission. Now they're hypertensives also.
Mm.
go into remission. They've been able to wean off people from drugs. And most recently, when I was talking to them, they said that even in cancer, they found remarkable results when patients follow the pillars of lifestyle medicine.
So now moving ahead, there's this whole conversation about protein, and also the whole conversation that Indians do not get enough protein. Now, what is your take on this, and how should one actually eat?
I am not an expert on this, so I think I'll basically one of my colleagues from dietary uh, the dietetics profession. They gave me a formula. You have a plate full. You should have half of it as protein, quarter of it as carbohydrates. But I'm not. I won't be able to give you the exact information on this.
Right.
Eat healthy, but broad guidelines. Avoid, especially children. Avoid junk food, coke, and drugs which have soda in them. Avoid sugar is supposed to be it is very dangerous. It's been proved to be very
Yeah.
dangerous. So stick to a very
So,
balanced
like,
diet.
I'll just give you a small anecdote. So, when you say sugars to an Indian mother, right, she'll be like, okay, I've not used sugar in this, but we have added jaggery and
Yeah,
palm sugar.
yeah.
So, are these equivalent to?
Very little difference between.
So, they are basically
Yeah,
equivalent.
yes.
So, for someone in their 30s and 40s or 20s and 30s, what are some of the realistic changes that they can do in their everyday lives to improve their health span and their lifespan?
Again, I think follow the same principles of lifestyle medicine.
Right.
Make sure you're not stressed out. Make sure you do exercise. Very important at that age
Mm.
because muscle loss starts at that around 40.
Right.
So make sure you exercise. Make sure you sleep well. Make sure you have good relations with your family.
Right. So another thing here is that in India, when it comes to healthcare and longevity, um, how far do you think insurance could help someone kind of pick up these things in terms of managing it on, like a broad scale, large scale basis, wherein more people get into lifestyle medicine, more people are incentivized to do this?
Yeah, actually, Devi Shetty has started something on insurance. Yeah, you're right. Now, insurance is only curative.
Right.
There is no incentive for being healthy.
Yeah.
So he's actually started a new different system in India at least,
Yeah.
where you go for checkups, and if you keep doing what you should do, you're incentivized.
Right.
You have an annual checkup and this and that. So I think there also is a mindset it has to change.
Right.
Insurance has to evolve in a way that it actually incentivizes
Correct.
good lifestyle practices.
Because I think as Indians, we definitely want to see what benefit we
Yes,
get out of
yes.
everything.
Anybody.
Yes. So, and the next thing is that is India actually ready for this entire revolution of lifestyle medicine? Because it's not something that we have seen. We've always been a nation of scarcity up until the last 10 years ago. We've always been the nation where, we always said the number of doctors to the number of patients, we are not able to match up yet. So, what is your take on this?
Actually, it will be an ideal situation for our country. We should not aim for too many doctors because the power of your health is in you. Having said that, I think almost every Indian has a cell phone.
Yeah.
So I think there is huge potential for transforming 95% of the our population into followers of lifestyle medicine.
Right.
We just have to educate them. We have to sensitize them. We have to make sure it's in the that policy also encourages. And I must say that the government has been doing a lot of things.
So, what are the policy changes that the government has currently brought about in order to kind of fuel this lifestyle medicine?
So you just look at food now. They are encouraging millets.
Right.
Now you go to any hotel, you find they give you all the details. It is required.
Right.
FSSA mandates that whatever is sold gives a breakup of what all it
Ingredients.
contains. So I think they're doing a big um, thrust on that. And we are actually trying to influence the government to try and introduce this into schools and colleges, lifestyle medicine, because that's where it starts.
Yeah.
And it's a little slow, but I think it will happen.
So, like that, just because you told me about labels, in Singapore, there's a system, I think, wherein they grade on the labels from A to
Yes.
D, E, F based on whether how good is it in terms of its ingredients and how versatile. Do you see that, coming up in India?
I think that what is happening now is a big step, because
Right.
earlier we didn't know what was in whatever we were buying,
Right.
and I think it'll ultimately go there.
Right. So, and apart from all this, you've been, quite an enthusiast in, like you told us during our conversations, in publishing a lot many books in matters that matter to the healthcare industry, that matter to every patient, every doctor, and every hospital administrator. What has your thoughts been in publishing these books? Because most of them you've got out a white paper on lifestyle medicine, you've got out an entire series on what's best to eat in terms of recipes and how to eat and how not to eat. So what has been the entire thought process behind each and every of this book?
As I said earlier, we used to try our medicine curriculum, MBBS and postgraduate. It's very limited. There's a lot more that can go into it, but then it's understandable that everything cannot go because they have only so much time. So I thought it will be good to choose topics that there is not much education for the medical professionals. Like technology, for example. When it
Right.
came in, we were very, very slow. So we wrote a book on technology. Geriatric care, except for the geriatricians, the very few people, because the geriatric diseases are very different from what you get, and you
Correct.
can't manage at the same time. And in geriatrics, we know that there's a shortage of geriatricians. We lobbied for more seats. There has been done through the Health Sector Skill Council where I work.
Yeah.
We've been able to train a lot of caregivers.
Right.
So those are the areas which are relevant.
I think a lot more people like you have been very vocal about geriatric care, because I think even in the biggest private hospitals today, you do not have a geriatric care department. But I think Baptist has it, and which is one of the few hospitals in Bangalore who have it,
I
right?
think that's changing. I think most of
Yeah.
the hospitals have now. Manipal has a big department. Yes, but it's true. But then, if you're going to wait for the geriatricians to come back and set up departments, you probably have to wait 100 years. So what we have done is now we are actually training MBBS doctors in geriatrics.
Right.
So they go back to their communities. It helps in some way.
Right. It definitely helps, because I think what people don't understand is they kind of see the geriatric patient as a patient who's just aged,
Yes.
but it is not so. There are a lot more
I was
factors.
to give you an example. I work with an organization called the Dementia India Alliance.
Yes.
So they run some research. So in an OPD which comes to the hospital, there are about 50 to 60% of people above 60.
Mm.
And in that population, at least 2 out of 3 have early signs of dementia, which nobody knows.
Right.
So that is actually a very scary.
That is a very scary and a
field,
very
So we are
alarming
trying to address that.
Yeah. If you could go back and give your 30-old yourself an advice, a piece of advice, what would it look like?
Yeah, I'd probably look after myself better. Make sure there was enough time to look after myself. Make sure there's enough time in the family. Unfortunately,
Right.
it has been very busy those days. And also try and influence the community around me with regard to that.
Right.
To that, it's not very difficult if you are disciplined and follow the tenets of lifestyle medicine. Results will be much better.
Right. So if you were to kind of, advise today, a young leader who's getting into young hospital administrators, that what were the things, that gaps that they could work on, or what are the challenges that, they could work to solve?
Um, See, there are two. One is at the broad level, which an administrator by himself may not be able to do, but at his level, it's important. As I said earlier, that he should be transparent, should have no hidden agenda. It's very important to network among healthcare professionals and realize that as a leader, he can actually have a lot of impact among his colleagues.
Right. So, what does leadership in healthcare truly mean to you? Like, what does it encompass, and what was something that really pulled you to take up healthcare?
Nothing in particular. I think those days we had only engineering or medicine. I wanted to become a vet, but family wouldn't let me become a vet. So I think it is a
Right.
matter of course. Nowadays there are so many different
Yeah.
options available.
So it's very also so many options that you kind of are left in a
Yes,
fix of what to pick
do
and
take
what
care.
not
Ours
to.
was our days were very
Yeah.
very different.
So just want to ask you a few questions about what were some of the books that shaped your thinking and
I think I'm a very religious guy, so I go through the Bible, and the Bible is the oldest book. It gives you a lot of insight into various, and as you grow older, it makes sense.
right.
And I think it's the same thing with the Gita and the Quran says.
Yeah.
But I go through the
Right. So with that being said, I think we've had an eventful
Thank you.
conversation.
Right.
I think with where healthcare is going,
Right.
and with longevity being such a huge thing. So, if you were to define what is longevity or health span and lifespan, how would you define that?
I just put it in towards this healthy aging. So
Healthy age.
healthy aging starts from birth to.
Right. Thank you so much, sir. I
Sure.
think it has been a wonderful,
Thank
impactful
you. Yeah.
conversation.
Thank you, Sharanya.
Thank you,
Yeah.
sir.